or I know an outline from the last time, and I'm not sure if we were going to follow the same one.
Yeah, I think we can, but
okay.
I can start us off, and then you can take over, Cynthia.
That's fine.
So we let me see if our slideshow will work. Hey, there it goes. We don't have any more technical difficulties. So I did start recording this. So it's recording now so that those who aren't able to make it can watch later. But I said all of the stuff I'm going to go over today is in the binders that we sent. And do you have the binders with you, LaShawna?
I just know those binders. Hold on, let me go. Great. I see them here. Hold on. I'm sorry. Hold on.
Hello?
Okay.
Did you?
I have the binder. Okay, I have it.
Okay. So in the box that we sent you, there should be a binder for each one of the staff members that has all of the information we're going to go over today, and that you can have as a resource or two throughout the study. And there's also like a manila envelope that says site visit materials or materials packet, I think.
Okay.
That?
Yes.
Okay. So I'll be talking about the things that are in there as well. That envelope is everything that you'll need to prepare for the site visit. So some things that are in there are also in the binder, but some of the things that are in there are not in the binder. So we'll be drawing your attention to those two separate places through the orientation.
Okay, now
and so,
just don't have their books right now. Still joining?
Yeah, absolutely, yeah. Because everything that we're going to be talking about, I'll be putting up on the screen. I think there may be a couple things. I'm just going to sort of mention, such and such is under tab 6. Everything we go through in detail, I'll be putting on the screen. So if they have a screen, do they will not have a screen either?
Okay.
Oh, so
I just give them the number to just join in with you. They're just going to join in.
Are there people who are just going to call in and listen and not have a computer?
Okay, thanks.
I'm not sure where we are, Jen. You want me to, are we waiting for them to kind of get settled, or?
Yeah, are you guys ready to get?
Yes.
Yeah? Okay. And do Nessa now, or?
Yes, I'm here.
Okay. I was like, wait, there's a new voice. Okay.
Yeah.
So we can start with introductions, and is there some other people who are joining us? Is that correct?
Yes.
Okay. So my name is Jen Torres, and I'm a research scientist here at Michigan Public Health Institute, and I'm the study coordinator for this study. So someone who sent you the consent forms, and you will be interacting with me in a variety of different ways throughout the study.
So you're sending me all those emails?
Yeah.
Okay.
And then I also have Cynthia. Do you want to introduce yourself, Cynthia?
Yep. Hey, this is Cynthia Zager, and I am presently also an employee of Michigan Public Health Institute. I'm working as the Senior Professional Development and Training Coordinator for Michigan's Home Visiting Initiative. Up until the end of July, though, I was employed with the Department of Health and Human Services as the Program Coordinator for the Home Visiting Initiative. So I've had a little bit of a shift in my role, but I'm able to continue work with this project as we move forward with the study. That's who I am. And then if you could both just kind of give us we know names, but if you could share with us what role you have with the program.
Okay.
So,
Lashana's going to go first.
Hi, my name is Lashana. Been in MHP since 2008. I do all the billing. And been the coordinator. I do a lot of the office work.
Lashana.
And Vanessa, the director, and I worked for about 3 MIHPs, and then I got my own. It was 1 year in February this year. I'm really excited. I like working with the moms and babes. Just really, anxious to see, how it goes, and if we can do input on how we think things should be done, or if we can make it. So I just was be interested in what this program is the outcome is gonna be.
Yes, and I guess I would like to just take this opportunity to thank you so much for agreeing to participate in this effort. We're really charting uncharted waters here and making our own trails in this effort. And I know that for some folks it really took a lot of thinking about if you wanted to be a part of it, because we don't know what's going to happen. But what Jen and I and the other folks who have been working on this project do know is that you are a quality program. And I know that is because there were some pretty specific criteria that program had to meet to be a part of this study. And so it's really important as we go through this discussion and as you start preparing for your site visit and go through site visit, remember that this study is about the tool and not about the quality of your program, because we know that your program is quality. So I guess I just wanted to kind of frame it with that statement before we move any further. Okay.
So, overview then. View of what we're going to do today. So first we'll talk about sort of the history of the study and give some details about like sort of review of the different parts of the study. And then we'll go into more detail on each of the different study tools, and then we'll talk in detail about the process for the site review.
Okay.
So with the overview of the development this study.
Okay. Thanks, Jen. So when we think about the concepts of quality assurance and quality improvement, we're really talking about similar but very different items. When thinking about quality assurance, we're talking about the things that determine whether a program meets the expectations for quality. We're thinking about how staff need to use their expertise to ensure that the program provides quality services. Thinking about how quality assurance really relies on external review, but yet also internal monitoring. So you're ensuring that the processes that you have in place result in the quality work and meet the fidelity indicators of your model. Thinking about quality assurance, we're also thinking about how your site might respond to expectations that are established by external bodies. in your instance, it would be, you know, the state of Michigan and the administrative body that exists within the Department of Health and Human Services. The next one does not necessarily apply to you. There are also expectations for programs that are funded through the Maternal, Infant, and Early Childhood Home Visiting Grants. They need to ensure that those programs are meeting those quality indicators of HRSA. And your program does fall on the expectations of PA 291, Michigan's law that went into effect last year, that really talks about the importance of quality assurance and the importance of monitoring quality of programs that are being funded. On the other hand, when we think about quality improvement, we're thinking about those things that determine whether adjustments to a program result in improvement. So are you doing things that make a difference in how your program is operating and the outcomes that it's achieving? When we're about quality improvement, we're thinking about using staff experience to improve the processes the program is implemented. We know that quality improvement most oftentimes relies on internal teams, so it's kind of a self-monitoring process. We know that quality improvement responds to the needs of customers and stakeholders, and again, it is an expectation for any MCV grant recipients that there is a quality improvement process in place. Next slide, Jen.
Yeah.
Currently, there are some different activities that are taking place both in the areas of quality assurance and quality improvement. In the areas of quality assurance, we are monitoring financial and contractual issues to make sure that what is, uh-oh, my screen just went black.
Oh, no.
Make sure, I got it back.
Okay.
Give me a warning there. Just to make sure that financial and contractual requirements are met. And with the MCV requirements, there are benchmark monitoring that also has to take place. In the quality improvement, there is a body at the state level that actually has organized a learning collaborative, and it's very actively looking at how home visiting programs are operating in the state of Michigan and working to provide support and technical assistance to improve areas where they might be struggling. There's been participation both by models as well as state leaders in a national learning collaborative referred to as the COIN. We also know that local implementing agencies like yourself, local leadership groups, and also there are also state CQI projects that are in place. So each of those entities are required to work on and develop a quality improvement project to look at using data to drive their decisions. We know that quality improvement is related to training and technical assistance. So when we see that there is need to improve quality in certain areas, we want to be able to make sure that people have access to training and technical assistance to improve those indicators. And you may experience that within your MyHIP program from state leadership with the Department of Health and Human Services. And all of this is well and good and certainly can lead to quality programming. But the truth is that it's not a complete quality assurance approach. What's lacking here is that we're not communicating the expectations for home visiting program implementation. We're not necessarily monitoring the quality of home visiting implementation across Michigan's home visiting system. So I'm sure you're aware that Michigan has a wide range of home visiting programs and home visiting models that are being funded through various ways and are being implemented in numerous different communities. And there's no way to really, that is established to really monitor across the board what that system looks like in terms of quality. The current approach does not provide a foundation for quality improvement, so there's no set expectation across that system for quality improvement processes to take place. And we also know that our current approach does not meet legislative or funding requirements of MCV or of PA 291. Next, Jen.
It's a little slow. So
sorry. All right.
Yep.
Okay. All right. And also, Lashana and Vanessa, if you have questions along the way and I'm not hearing you, if you push one of your number buttons, I will hear that. So if a question and you're not interrupting me well, then feel free to push one of your number buttons and I'll hear that. Okay. All righty. So what is this PA 291? You may be familiar with it or not. People don't follow things that closely, so for those of you who might not, PA 291 is indeed Michigan's home visiting law. And what it does is it defines the home visiting system as the infrastructure and programs that support and provide home visitation. So the infrastructure and programs that support and provide home visitation. When we think about infrastructure, we're thinking about things like training and technical assistance, quality assurance. Are there human resources in place? Do we have a training structure in place? Things like that. So built on the idea that evidence-based programs have comprehensive home visiting standards that are high-quality service delivery and continuous quality improvement. And I know that you're very familiar with the standards that are expected from the MyHIP program. The law also requires that state-funded home visiting programs operate with fidelity to the program or model. And so all departments that are funding programs that receive funding through the state are required to ensure that their programs are operating with fidelity. And I'm aware that the MyHIP program actually does have a system in place, but not all programs do. And so we were curious about what it would be like to establish some sort of quality assurance monitoring system across all models, which kind of gets us to the next funding requirement. So infant and early childhood home visiting funding requirement does indeed indicate that we must provide a plan for ongoing monitoring of implementation quality. We have to include our overall approach to home visiting quality assurance, and we also have to ensure that we are maintaining quality assurance. Are you familiar with the funding source from HRSA with MCV?
You said that to us?
Is that something that's familiar to you, Vanessa and Lashana?
The funding?
Yes.
I'm not really familiar.
So there's a significant amount of money that has been made available to states, and Michigan is one of them, to be able to fund home visiting programs.
Okay.
Michigan has an internal source, i.e. Medicaid, to fund MyHIP. Is one of the reasons why MCV funding is not used to fund your program, but also because of the requirements of an evidence-based outside of the state of Michigan. There are specific requirements that we have to follow as a recipient of HRSA funding through MCV. And quality across all of the models that are being funded is one of them. Currently, the state of Michigan is funding the Healthy Families America model, the Early Head Start model, and the Nurse Family Partnership model. But we also know that there's a fifth model in addition to MyHIP, Parents as Teachers, that's also frequently funded in Michigan.
Okay.
Jen? Okay. So, how this whole project got started was back in 2012. I was listening in on a technical assistant support call, and we were getting guidance on needing to provide these quality assurance systems. And come from a model, Healthy Families America, which you may or may not be familiar with, that does have, much like MyHIP, a significant number of fidelity indicators or standards. And I'm sitting there in my head trying to calculate all of the fidelity indicators that was personally there between Family Partnership, Early Head Start, and Healthy Families America. And I'm listening to them tell me that we have to figure out a way to monitor all of them, and I almost fainted because I know, right? I know how challenging it is. Even, can you hear me?
Yeah.
Okay. I just know how challenging it is to monitor even one program, much less think about having to monitor up to 3, 4, or 5 if we're now talking about all state-funded models. We don't know.
Cynthia, sorry, I think we have somebody new.
Vicki? Yep, Vicki Erickson.
Hi, Vicki. Welcome.
See, I just got the web code number and all that, so yeah,
Hi.
It's just people from all my children, or is these more people, or?
Yes.
Oh. Okay. Oh, yep, I'm here. Yep.
Hello, Vicki.
Hi.
We have I'm Jennifer, and we have Cynthia from Michigan Public Health Institute.
Okay, well, big hello to you.
Hello to you too. Welcome.
Thank you.
Do you have the screen up in front of you? Have you been able to get on?
Yeah, I don't. I didn't know. I had to have my, we had to be a computer, so I don't. But I'm listening. So.
Okay. All righty. Just picking myself off the floor when I was remembering about the requirement that we were being told we had to adhere to in terms of ensuring that models were meeting all their fidelity indicators. And one thing that we know about quality, and maybe you can relate to this, maybe not, but I know what is true for most programs is that there's something that's referred to as drift. So, in other words, programs like Healthy Families America, who have to go through an accreditation process every 4 years, kind of gear up for this 4-year event and ensure that all their I's are dotted and T's are crossed at 4-year intervals. Now, it's not to say that it's their intention to not comply with the standards in between those 4-year markers. The truth is that life is busy, that we need to be able to do our work, and we tend to often drift of what those indicators require of us. And again, I know oftentimes that there's no ill will intended, that we all want to do our best because we know when fidelity indicators are met, we have high-quality services. And when we have high-quality services, it makes a difference for children and families in Michigan. Sorry, I got off on a tangent there. I get on this little soapbox about that. But it was part of the process about thinking about what that meant. We knew that it wasn't just about checking a box to see if a model had gone through their required accreditation process or whatever it is that a model calls it. It wasn't just about getting a letter from MyHIP or a letter from Early Head Start saying this program meets all of the standards. We are expected to ensure that models are adhering to their fidelity indicators over the course of time and not just any given point in time. So at that point, I called a colleague. At that time, I was working for the state, and I called a colleague at MPI, in fact, it's Jen's boss, Julia Heaney, and I said, Julia, we have a task in front of us, my friend. And at that point, we started talking about forming a work group to represent all of the models in Michigan, together who were model experts who could speak to what fidelity indicators were of each of the models in Michigan. We also had representatives from other state partners like the Department of Education. We started to get together. We started by exploring what the evidence base and research was around home visiting. We looked at literature across all types of research documents from folks like Deb Darrow and John Korfmacher, and other researchers in the area. We also looked at existing tools that already had been established to look at quality in home visiting. Oops. Sorry, Jen. Could you go back?
Well, I think I went to this one because you were talking about it.
Oh, back though.
Oh, yeah, sure.
We also received consultation from national and model experts, including Deb Darrow and John Korfmacher, which was really fun, and the Technical Assistance Center through HRSA. But then began to really dive into this research and began to look at what are the quality indicators, what are the domains we felt and believed and had experienced that really defined quality in home visiting. What were those areas that most important in quality services? After we did a deep dive into all of that and kind of came to some agreement about what those domains were, we began to develop this model standards and measures under those domains that we identified, and we're going to get into that a little bit later. We developed a tool and a process for assessing quality, and ultimately, with the last funding source that we received from HRSA through the McPhee funding, we did receive support to be able to field test this tool that has been developed.
Sorry.
That's okay. I think that this one kind of does overlap that other one a little bit.
Yeah.
This one kind of gets into the details, and I probably addressed much of what it is, but let me see the pieces that that I may not have. Yeah, one of the things that the committee did is we created a crosswalk to look at all of the standards of each of the models and how it compared with the data that we were developing. We looked at the concept of implementation science and all of the infrastructure components that are important in any successful running program. About the expert consultation. Yeah, those two slides are kind of similar. This one just kind of gets into the details of it. So.
Yep. Okay.
Jen.
Yep.
Okay. So these domains that the committee selected include areas of recruitment and enrollment, visitor caseloads, family needs and referral to services, duration, visit content, staff qualifications and supervision, development, and organizational structure and support. Okay.
Okay, this part I think is me. All right, so now I'm going to talk a little bit more about the study. So these are 4 research questions that are guiding the study that we're doing and that you're participating in. So the first question is, do the tool and procedure produce reliable and valid results? We were really interested in, didn't talk about all of these different steps that we went through in order to create the tool, but we want to make sure that it actually does what we are thinking it does, that it's something that is used reliably by different reviewers over time. So we're really looking at, are the results similar when the tool is completed by different reviewers? So if 2 people review the same site, have all the same information, do they end up with the same ratings? And so then that would mean that we've created a tool that is short enough that different people can fill it out and come to the same result. Part of that is whether the tool and the procedure really measure implementation quality. So we actually measuring what it is that we set out to measure in the beginning. And so there are a variety of different things we're doing in order to test this part of the question in terms of the validity. The second question is, can the tool and procedure be applied across models implemented in Michigan? And so that relates to what Cynthia was saying about how one requirements for this process is that it is able to do that. And so that's a really important question for the study, is how well does it work for different programs, models, and areas of the state. The third question is, what are the costs to the state and to local home visiting programs associated with preparing and completing the review procedure? And so I want to know if this process was rolled out as it is currently designed, what cost would that mean for the state for doing it and for the sites participating in it? So that's sort of an estimate of what the cost of the whole process is. And the study question is, how can the results of the tool be used to improve quality in home visiting at the local and state levels? And that's going back to those different elements that Cynthia was talking about quality assurance and quality improvement, and that part of the quality assurance process is that it should really lay the foundation for quality improvement and want this tool to be useful, right? It's not just a monitoring tool, but we want it to also be useful for sites so that the information you get from going through this process is something that you can actually use in order to improve the services that you're providing family. Do we have other people who have joined us?
Crystal.
Hello.
Hi.
Hi, Trisha. Do you have a screen in front of you, or are you just calling in to listen?
On the computer also.
Okay, you can see the slides.
Mm-hmm.
My name is Jen Torres, and I am from MPHI. I'm the study coordinator. And I also have Cynthia.
Hi, this is Cynthia Zager, and I am the professional development and training coordinator with MPHI, who's working closely with this study.
Introducing ourselves, or?
I'm Vicki. Hi, I'm the Diatu.
Hi. Oh, that's all right. Make sure first to have you tell us your role.
Oh, you're fine.
And Patricia?
Sorry, I'm a registered nurse. I'm with all my children in my HP.
Oh, great. We have LaShawn and Vanessa who have been with us. Okay, so in participants for the study, there are three main groups of participants. The first one is a home visiting implementation expert. And so this is of that, checking the validity of the tool, that first research question. We created a survey that we sent out to people who are sort of experts in the field of home visiting quality and implementation to get their feedback on the tool and to see if they think that it's capturing the key concepts in home visiting quality. And so that's something that it's now, and people are completing that currently, and we're looking for about 10 people to do that. And the other two groups of participants are the reviewers and the home visiting sites that are actually going through the process. So reviewers are conducting the site reviews, they're taking their time and resources, and they're completing satisfaction surveys to provide feedback. And then the home visiting sites, like yourselves, participating in the site reviews, they're helping or working with us to coordinate observation of home visits. They're providing a recent model review, tracking their time and resources, and complete satisfaction surveys. We're going to go through each one of these different parts of the study in detail today, but this is just sort of an overview of who's in the study. And then this is an overview of the different tools that are part of the study. So the big one is Michigan's Home Visiting Quality Assurance System tool, which we refer to as the tool. And that is, that is what will be used for the site visit and the review. And there's the implementation expert survey that I mentioned. Home visit rating scale is the measure that's used for the observation of home visits. And then there's satisfaction surveys, one for the reviewers, and then the sites have one for right for the review, and then 6 months later. And then there's the cost tracking tool that is completed by both reviewers and sites. Like I said, those that are important to you, the things you have to fill out, we'll go through in detail later, or through the rest of the orientation. So the next part is to really start this introduction to the study tools. Before we do that, does anybody have questions?
No.
No? Great. And then, feel free to stop us at any point if you do. And then, Cynthia, I think this part is you.
It is. Okay. So for those of you who are only listening in, this may get a little bit confusing, but I'll do my best to try and be specific and hopefully be able to go back to your binders and remember every single thing I said about it. we'll see how that goes.
I am recording it. I'll just repeat that for the people who joined. I am recording it so that you can watch it back later, and people who missed it can watch it too.
True.
Thank you.
And Jen, the tool that we're going to be going through right now is in section 4 of their binder. Is that correct?
Yes. Yep.
So for those of you who have the binders in front of you, if you flip to tab 4, go to page. Go ahead.
Cynthia, do you want me to pull that up on the screen, or do you want me to leave the slide up?
Just leave the slide up for right now. I just kind of want to give them a point of reference.
Okay.
So we're good. That the document is organized. Again, we put it under domains as the broad category, and standards are a subset of those domains, and measures are how are we looking at whether or not the standard is met. Each standard requires that a policy that aligns with model requirements and evidence that policy has been implemented. Every standard will have a policy expectation that we'll get into a little bit later. And each measure is rated as either fully met, partially met, or met. Okay, Jen?
Yep. Do you want the guidance document?
Yeah, the next slide. There is. And then can you go to page 7?
Here?
Yep, there it is. Yes, it'll be page 7 in your notebook as well. Okay, I'm having a hard time seeing it, but I guess I don't really have to. So here you see, what's that?
Here.
Yeah, thanks, Jen. Thank you. Thanks. Okay. So here you see that domain of recruitment and enrollment that I referenced earlier in the presentation. Within recruitment and enrollment, we're looking at the standard of do home visiting sites recruit and enroll families that meet their eligibility criteria. So that is the standard. That's standard 1. Within standard 1, measures. And with standard 1, you'll have measures 1.1, 1.2, and 0.3. So in the first column, exactly what we're looking to see if the state has in place. Okay. And that second box is the expectation and the required components. These are the things that we're wondering, as this is a study, we're wondering if programs have these sorts of components already a part of their own visiting program. Column, use a review procedure. So this is guidance for the reviewers as well as for you to understand what the reviewer is going to be looking for, either pre-site, before they come on site with evidence that you submit to them, actually on site, they're at the visit on the day of your review. Fourth column, you'll see the rating scales. And just as I noted on that last scale, on that last slide, there are three possible scores. Either fully met, meaning that all components that were in the expectation are met. Partially met, meaning that fewer than 4 components are met. 1 is unmet, meaning that documentation does not exist, that the model doesn't have expectations, cannot describe the steps that are required. In that fifth column, it indicates whether or not a is on the agenda. This on 1.1, that agenda item is kind of shaded out because this is a measure that will be looked at prior to the review coming on site. And that last column is just area for either you, if you're so inclined, or the reviewer to kind of make notes. So that's kind of a 32,000-foot look at the outline of how this document is structured. I just want to stop for a minute and see if there are any questions at this point. Oh, okay. Okay, very good. You see, now here's where I got all messed up last time, and let me make sure that I've got this right. You'll see, where are those cues? Oh, there it is. At the bottom of page 3, you'll see that there's a code for different signs that are tool. In that middle box, you'll see it says self-assessment. At the bottom of that middle box, it says measures that should be completed as part of the self-assessment and rated prior to the site visit are identified by an asterisk. You'll see that all of the expectations that start on page 7 that are required to be completed before the visit are identified with an asterisk. Below that, you see the column that says, or the row that says site visit and the explanation about what a site visit is. See, there are two signs there, the greater than sign and the plus sign. Any expectation and required component that you see identified with a greater than sign is identified actually during the site visit through use of things like viewing files or reviewing resumes or things like that. The plus sign are those indicators that are determined a rating through interview. So it's you an idea of how we're looking at obtaining the evidence that we're looking for. Does it make sense for everybody?
Yes.
Yeah. Okay. Excellent. So I think what we'll do next is kind of go through not necessarily each of the individual measures, but maybe what we'll do actually is go through one of them so you kind of get a feel for the pattern that exists and see if you have any questions at that point, and then we'll go from there. So here we have recruitment and enrollment. The state within recruitment enrollment is the recruiting enrolling families that meet eligibility requirements or criteria.
I'm gonna for 1 minute. This is Patricia. I have to pick up my child from school.
Okay, Patricia. Thanks for joining us.
I'll try to get back in if I can.
Okay, great. Welcome. Every standard, all of them have expectations. of policies. And first measure, 1.1, there's a policy expectation. So is there a policy in place that guides the program eligibility criteria, the target population, procedures for assessing eligibility and enrolling families, and expected time frames for completing enrollment procedures and conducting an initial home visit? Here we have a qualifier that policy shall reflect model expectations if applicable. So we want to make sure that as we were establishing this tool that we were being very respectful to the quality indicators that were already in place for the models. And so you see that that is done through reflecting that reference back to the model expectations. So if the reviewers come out to your site, we have a binder that's a crosswalk with those the MyHIP quality indicators that crosswalk with the indicators that are in this tool. Okay. What the viewers are going to be looking for in regard to this area is looking to see that there is eligibility criteria that limit who may enroll, that have to reflect the model requirements. We're going to be looking to see that the policy has a process for conducting a community needs assessment to identify families that are most in need of services, that the policy includes procedures or steps taken by the site to assess eligibility and enroll families. And they're also going to look to see if the policy includes expected timeframes for completing each step in the enrollment procedure, which does not exceed 30 days. To go through and start to, I'm not going to go through every single one like this, but as you start to really dive into this tool and start to kind of relate to how your model is designed, people to get anxious because they start to think, oh my gosh, we don't have that, we don't have that, we don't have that. And that's the last thing that I want you to do. Because that's what this study is about. It's about learning what some do have in place and don't have in place. So just because it says in this tool that we're looking for does not mean that that you're required to have it. Okay, I really want to make sure that that's clear. This is the part of the process. Okay. Questions about that?
No, ma'am.
Okay.
No.
All right. Okay. As we go through the different measures, the next measure actually looks at if you have a plan based on a written plan that's reviewed on an annual basis that's in alignment with policy and procedures. So do you have a plan that describes your strategies for recruiting families? Do you have a plan that describes your strategies for recruiting families who are in the target population eligible for your program? You have procedures for monitoring, reviewing, updating, and improving the plan. Typically, in this pattern, there's an expectation to assess whether or not each of the programs are complying with their policy. So that's what this the measure looks at. And then 1C, are you actually doing it? Are you enrolling families that meet your eligibility criteria? And do those families reflect the target population as specified in your policy? See that in that third column, what we're looking for here are going to be numbers and percentages. And so any way that you collect data around this could be a way that you submit this evidence. We also have worksheets. And Jen, are you going to talk about those worksheets?
They're on the next slide, but we can talk about them whenever you want to. Do you want me to pull them up now or later?
Okay. Why don't you pull that up? Let's see. You go to one of the actual worksheets. Okay. In fact, yeah, perfect. So this worksheet actually reflects a measure that we just taught. We were just looking And so this could be, if you choose, the other thing is it's not required that you complete this report to show for your evidence. If you do have the data, you can just say that you did not have the data, and that's okay. If you choose to submit this, then it gives you a process to be able to figure it out. So it's asking for the number of families that were recruited in the previous 12 months, the families that were recruited in the previous 12 months who were eligible for the program as specified in the site's policy, the families in the previous 12 months who were members of the population, the families that were actually enrolled, families who were members of the target population, and families that met the enrollment criteria as specified in your contract, if applicable. And you can see we break it down by each of the months. So again, this is an optional thing that you can choose. Perhaps you have a data report that you can provide, or you can say we don't collect that data, and that's you. Any questions about that?
No.
Okay. Now, with this measure is where we start to get into the interview questions. So you'll see in that third column, towards the bottom of that column, there's a plus sign. So when the reviewer is on site, she's going to ask you about if you had, is this one that we're actually not asking about if they had any issues? We're addressing that differently, aren't we, Jen?
Yeah, but I think we're still asking the other two.
The two, yep. So she'll ask you about the degree to which that met your site's expectations for your performance, and also ask about how recruitment and enrollment data has been used to make improvements. So are you using that information to be able to improve your services? And that fourth one in this particular measure is, does the home visiting site serve as many families as it has the capacity to serve? Similarly, this also has a sheet that you may choose to fill out or not. In it, if you do, you're going to be indicating the number of available slots for families. You don't have to figure out the percentage, but you can choose to if you want. You'll see it on the worksheet as you go through the different worksheets that are made available to you. And again, our interview questions that the reviewers will talk about is they'll talk about why the available slots were not filled, and they'll ask you about strategies for ensuring that the site serves as many families as it has the capacity to serve. On that, for these few questions, did we make any modifications based on what we learned about these interview questions taking like 3 days if we kept them the way they were?
We did. I don't offhand what they were.
Okay.
But
I'm wondering if
we created interview protocols, and I can have Sam send those to you, Vanessa, so that you know what questions you're going to be asked. So that.
Okay.
in the document that you have in front of you, you should see that in the sixth column, it says Interview Program Manager. And so for any of the interview paradigms, it will indicate who's going to be being asked those questions. A program manager or the supervisor or any of the home visitors, the nurse or the social worker or the dietitian.
In the sixth column?
And the last column is for any note. The fifth has who you see that there? Do you see who? There's program manager.
Okay, yes.
Okay.
Yeah, so I think that changed. We blended the program manager and the supervisor.
Okay.
They happen together, and then the home visitors, so the nurses and the social workers, would happen
together too. Great. Okay. So I'm getting a feel for how this kind of goes at that point, looking at that first domain. Again, I don't necessarily want to go through each of the domains in that detail. What I'd like to do is to go through at least the rest of the the overarching domains, and then the standards, and see if you have any questions about those. Okay? So the next domain is home visitor and supervisor caseload. Standard, the first standard around that is do visiting sites maintain appropriate home visitor caseloads? The standard within that domain are, do home visiting sites maintain appropriate supervisor caseloads if that's called for? Next domain is the assessment of family needs and referral to services, and the first standard within that domain are is, do sites assess family needs and provide referrals when appropriate? And that's a long one. There's a lot of things that we're looking at in that standard. Okay. And then the next standard within that domain is, do the sites conduct developmental screenings and provide referrals when appropriate? Am I going too quickly, Jen?
No, fine.
Okay. The next domain is around dosage and duration. Oh, one thing I didn't point out is that within each of the domains, you can kind of get a sense of rationale why the work group made a decision to choose that particular domain. So you see for this particular one, the evidence base is that home models have been shown to demonstrate specific intended outcomes. Those benefits can only come to fruition when a family receives, I got a throat. Family receives the services. Gosh, hold on. Receive the services that were intended by the model. Maintaining fidelity to home visit completion has shown to be correlated with strong family and child outcomes. There's evidence to suggest that when there are longer time periods between initial visits, families are less likely to successfully complete the program. So I think that that's something that can be helpful to you in understanding the reasons why the domains were chosen. So I just point that out in regards to this one. In dosage and duration, we have standard 6. Our sites provide home visits with the frequency and length of visit necessary to achieve intended outcomes for families. Standard 7, if the home visiting site retains families until they complete services, and do they support families as they exit the program? The next domain is around home visiting content. Standard 8 is, does the home visit site individualize program delivery to family risks and needs, as well as family strengths and protect factors? 9, dig to if the site is using an evidence-informed content, curriculum, or curricula. What are the materials that you're using in the home? Standard 10, look at building positive and productive relationships between home visitors and families. The next domain is around staff qualifications and supervision. So standard 11 looks at if the program is staffed by qualified supervisors. 12 looks at whether the site is staffed by qualified home visitors. 13 looks at if the site is providing home visitors the supervision that reduces the emotional stress of home visiting, reduces burnout and turnover, and improves performance. And standard 14 is around supervisors receiving that same support to improve their skill and effectiveness. Around the domain of professional development, 15 look at if sites are providing staff with the training that's necessary to deliver the program as it's designed. The next domain is organizational structure and support. Standard 16 look at if the site is receiving guidance and support from partners. So if you're a part of a local leadership group or a Great Start Collaborative, or you have a governing board of some sort. 17 looks at whether or not the sites have the infrastructure necessary to support quality implementation. Kind of digs into your nuts and bolts. Are there computers available? Is there a data management system, human resources, etc. State 18 looks at how sites are assuring and improving program quality. So is there some system in place that has a program looking at it? And then standard 19 is regards to integrating the program within the broader service system for children and families in their communities. So actually this is the one that reflects more involvement in the Great Start Collaborative. So, any questions about that broad look at the tool? No.
No.
Okay. All right. Very good. Where are we now, Jen, in our, to flip to my sheets?
I have one question. On the notebooks that you gave for staff, will they put a little extra paper in there that they can write notes on, or?
The staff?
Yes.
Yeah. Jen, I'm not sure if there are extra pieces of paper, but they are welcome to write notes anywhere they please. They're also welcome to add pages if they would like to add notes to their.
Great.
Am I right, Jen? Those
are yours to keep. You can do whatever you want to do with them.
Okay.
What's most helpful for you.
Okay.
So mention the model-specific guidance, but maybe we should pull it up so they can see what it looks like.
That's great. That's a great idea, Jen. Oh, we just happen to have a MyHIP model requirement. So you can see here for that Measure 1.1 that we really kind of dug into a little bit deeply, in that second column what the expectation of the tool is, what the requirement is, and then what the model requirement is. So when the reviewers come out to your site, they're going to be looking and making sure that they are cross-referencing what model requirement you already have in place. And so all of the model requirements, MyHIP model, are indicated in that model requirement column for each of the measures that ask for you to reference expectations. Anything else about it?
Maybe just that. So I think this is mostly for the reviewers, so that know what to look for. That they have that information about what the policy is, so they can make when looking at your policies, they align with the model requirements. Because I know we had one site that got a little bit confused in terms of documentation, whether they were supposed to be sending us documentation looking at this. And I think, this it's pulled from, Medicaid manual and operations guide. So these that you already have. So it's mostly just summarizing those things for the reviewer, so they have like a quick reference. So.
Yes, Jen. Any questions at this point? Okay.
The thing that's on this slide at the bottom there is the checklist. That's referring to in that site visit packet that was in the little envelope under tab 3. It's called Document Checklist. It's like this. Do you see it?
Yes.
Okay. So this is another thing like the worksheets that it's not required, but it's a tool for you if you think it would be helpful. And basically, it's just a checklist of all of the different documents that need to be submitted prior to the site review. So as I mentioned, those are labeled throughout the guidance document. But here, they're sort of pulled all into one, one like list. And so the front page here does give you some information about submission documents and how to label them. So whether you use the worksheet or not, we do ask that you use this process for labeling the materials that you send to us. Would label it, document X for measure X.X. So for example, goal setting policy for measure 8.1. If there's more than one measure that's in there, then you would put both in. So it would be, home visit content policy for measures 8.1 and 9.1. And then if a document is longer than 2 pages, we have to also label the document with the page numbers that include the information that we're asking for. So for example, continuing that same example, if the evidence for measure 8.1 is on pages 2 and 3, and evidence for 9.1 is on pages 6 through 10 of a 30-page document, then label the first page 8.1, see pages 2 to 3, and 9.1, see pages 6 to 10. Just make sure that the reviewer finds the information that they need in order to deciding for that particular measure, and make sure that the reviewer is reading what you were intending to send to them. So if the documents aren't labeled, then the reviewer isn't going to be able to review them because they don't know where the information is. That's about that part. Okay, so basically this is just a big long checklist of all of those different measures that are asking for documentation. And so if you want to, just use it and check it to make sure you have everything. If it's helpful for you to write the name here, you can do that. But again, it's not something that you have to do. It's basically just a tool that we created. We thought might be helpful. That is. So the next thing that I wanted to talk through is the quality report. So the quality report is in your binders. It's under tab 5. I'm going to pull it up. It looks like this. Did you?
Yes.
Okay. This is the form that the reviewers are going to fill out after the site review. So each of the reviewers will fill one out, and they will work together to determine final ratings, and they'll send you that sort of final version that they have decided on. And they'll also have a phone call to discuss that with them and to go through it. So you'll see that on the second page there, this is an overview for each one of the standards, whether it was rated as fully met, partially met, or unmet. In the total column, that's the number of measures that are within that standard. So this will give you an overall picture of the results of the review. There's a spot where reviewers might put in some overall comments, and then you'll get detailed information for every single one of the measures. So you'll get the rating for each, and the reviewers will decide on opportunities for improvement or special recognition for those. You have the conference with them. You can walk through it with them and have a chance to ask them any questions about the ratings or the comments that they have throughout. So that's the quality report. On that one?
No.
Okay. The next one that I want to talk through is cost tracking. So in the review materials packet in the manila envelope, there's a cost tracking tool for each of you under tab 5. like this. So this is the tool that we're using to track the cost of the review process. So each staff member who participates will send these out. And so you each have a paper copy, but when you submit this to us for the study, it'll actually be submitted online. And Sam Jones is the one who sent you the box with the binders in it. And she's the person who's in charge of materials. She's also the one that you'll be sending all of your materials to. And she's here at MPHI. And so send each person their own link to a cost tracking tool. And you do actually have the option of filling this out online, and you can revisit it through that link and add to it if you want. And then you have everything in there, then you hit submit at the very end, or rather fill it out on paper and just use the online version to fill it at the very end. You can do that as well, whatever works better for you. But the online version has the exact same questions on it. So it basically has different parts here. The first one is before the review, so we want to know how much time you spent on each of these different activities compared to the review. And for each, and then here in this second to last column, there's an other category in case there's something here that is not, in case you do something that's not in this table. And actually, one of the questions we've gotten so far is whether or not this orientation should go in here. And we probably should have put it in there. That would have been a good idea. So if you could please include that as other, and then down here is where you describe the other activities. So you just write orientation here and how you spent on the option today. That would be helpful.
Okay.
The other part, the next part here is the site review. So the time that you spent on each of these activities or something else that you did as part of the site review, so we can get into how much time that requires. The last one is only needs to be filled out one time, so only one person needs to do it. And this part is for the overall agency cost. So how much did you spend each of these different things as part of the review process? And again, there's a space for other in case there are additional things that I didn't think to include. So are there any questions about that one?
Yeah.
Alrighty.
Question like,
yeah.
Just applies, like you're talking about the copies that I sent to you guys? And
Yeah.
Okay, and
yeah.
then the meeting space that we or a client?
Just if there's any meeting space that you had to use as part of the review. So if you have to reserve a room for the interviews or something like that, that was there.
Okay.
Yeah. Okay. And if you have any questions about these things, you sit down to fill them out, don't hesitate to contact us. You can ask me or Sam, and we'd be happy to help you. And the things that we're doing as part of the study is that if people have questions along the way about procedures, we want to know that everybody has that information. So they get emails from Sam every now and then saying, somebody asked the following question and here's the answer in case that question comes up for you. So if you ask us a question, that would be something that we send out to the rest of the study participants as well if we think that it's that would be helpful for them. So definitely let us know if you have any questions along the way. We are to help.
All right.
Okay.
So then the next one is, so there's not a copy of this in your binders, but this is the home visit rating scale. So that's the measure that we're using for those observations that we're doing of home visit. And so we will observe one visit for each one of the home visitors. The things that this rating scale looks at are home visitor responsiveness to the family, home visitor-family relationship, home visit facilitation of parent-child interaction, home visit non-intrusiveness or collaboration with the family, parent-child interaction during the home visit, parent engagement during the home visit, and child engagement during the home visit. This measure is not something that would be part of the review process. This is one for the study. This is one of those things that gets at that first question again about validity. So we would be comparing the results of this with the results of the tool to see if the same areas of strength are identified in both, because it's a well-established tool. So if our findings with our tool match the findings from this established measure, then that helps us know that we're doing a good job of covering those areas of quality. And then the next one is the satisfaction surveys. So the satisfaction surveys, these also are not in your binder. Sam will send each one of you a link, an individual link to your own survey after the site visit. And things that you can expect to be asked about there are your satisfaction with the process of participating in the review and working with the reviewer, strengths and limitations of the tool. So we're definitely looking for your feedback on the tool. And then also strengths and limitations of the reviewer findings. The quality report that I showed you earlier, we would definitely like some feedback on that as well. And so you'll do those right after your site visit. And then we have another one that's 6 months later, and that one focuses more on, actions that you've taken as a result of the review process. And that's getting at that last research question about whether or not this process can inform quality improvement. So, were things that were identified in that quality report, were they things that were useful for you, things that you were able to, put in your program to make it better? So the next part is to talk through what this process is going to look like in detail. Start by going through roles and responsibilities for us, for you, and for reviewers. Our responsibilities here at MPHI, we are orienting reviewers and LIAs to the tool and the review process. So the reviewers have already been trained. We're doing orientations with each of the sites as they sign on to the study. We also coordinating the scheduling. So you worked with Marty here. She's a scheduling coordinator for the study. You worked with her to schedule your review date and to schedule this orientation. You'll also work with her to schedule those home visit observations. I'll talk in a couple of minutes about what that process is going to look like and what would work best for you in order to do that. We're also facilitating the sharing of documentation between LIAs and reviewers. So you'll send Sam the review materials for the reviewer, and she'll send them on to the reviewer. We're going to facilitate a consensus meeting between the reviewers. So when them is done with the site visit and they have their quality reports done, we're going to help with that meeting where they decide what the final ratings are and sort of draft that final quality report that they'll give to you. In terms of responsibilities for reviewers, they are providing their availability to us so we can schedule. After the on-site reviews, they're reviewing documentation and rating it using the guidance document. And they have a worksheet that goes along with that calculation worksheet that Cynthia talked about that we showed you earlier. So whether you provide reports or worksheets, they have their own sort of version of a worksheet that will help them answer those questions. Each reviewer is conducting 1 or 4 one-day on-site reviews. So I have 2 that are in their personal model of expertise, and then that are outside of their model of expertise. In terms of lunch, since they are there the whole day, looking at the reviewers bring money for lunch, but that sites have some available to go pick up lunch for them. They're going to work independently, and they're not going to discuss their ratings with each other. So that sort of, so you're aware that they're not going to be talking to each other while they're doing the site review, while they're there. They will both be in the interview. So for interview portions, both of the reviewers will be there at the same time. And there is one measure that includes a tour of facilities, and so they'll both go on the tour. But they are supposed to work independently, and that's the reliability piece. We want to see if if they're seeing the same things, do they get the same ratings? So we don't want them to talk about them while doing it. The reviewers also are scheduling a time to review the report with you. So at the end of the site review, there's time set aside for an exit interview, and as part of that exit interview, you will set up a time with the two reviewers that's 2 months out to that meeting where you talk through the quality report. After the on-site review, the reviewers are submitting their final ratings on each measure to us, and then they're going to participate in that consensus meeting with us and each other. They're going to draft a final quality report for you, and then participate in the phone conference with you to discuss it, and they're also completing satisfaction surveys and tracking the time that they spend on review activities. In terms of your responsibilities as a site participating in the study, you've already provided us your availability for scheduling, and prior to the on-site review, you will be sending required documents to us so that we can give them to the reviewers. And then also, in preparation for the site review, you'll be pulling materials to be reviewed on-site and working with us to coordinate observation of home visits. Then during the review, just make sure that staff is available for the site tour, and that as many people as possible are available for the interviews, and then being prepared to pick up lunch for the reviewer. Agenda that we'll talk about in a couple of minutes that lets you know what time the interviews are at, so you know when to have people available. At site review, you'll participate in that phone conference with the reviewers to go to the quality report, and then you'll complete the 2 follow-up surveys. And then you'll provide the results of a recent review by your model developer and track the cost of the review process. So here, binders, there is a document called Site Visit Protocol, and it's under tab 6. So I'm actually going to go through that in detail because pretty much everything in there is what we're going over today. So it would be kind of repetitive, but it is there. It sort of pulls together all of the different parts and pieces. It covers scheduling, materials, documentation, preparation, the on-site review, the phone conference, tracking, and the satisfaction surveys. What I'm going to do is I'm going to walk through some important dates and deadlines and talk about scheduling, the observations, and talk about the agenda for the day. In that site visit protocol, you'll see Sam's contact information is in there about 7 different times. So if you have any questions, that's the place to look. There's also in the very back of your binder, there's a contact information sheet. So important dates and deadlines. So your visit is scheduled for November 17th, and home observations we would like to have happen that week or the 2 weeks following the review. That would be the week of the 16th, the week of the 23rd, or the week of the 30th. In terms of documentation, we're asking that you submit that 3 weeks prior to the review, so that would be October 27th. And we will send you that final quality report 1 month after the review, so that'll be December 17th. and you'll review the quality report 2 months after the review. So that'll be in January, around January 18th. The costing tool, we ask that you submit 1 week after the review, so that would be by November 24th. And we will send you, Sam will send you a link to the satisfaction surveys the day after the review, and then we do ask that you complete them within 1 week of receiving it, and then do the 6-month follow-up survey 6 months after the review. Again, ask that you please complete it within 1 week of getting it. Other questions about that?
Well,
now just back up a little bit on the site, you know, it's prepared to have lunch, but they tell us what they like to eat.
Yeah, I think you could probably have just a conversation maybe about what's around there.
or if you have menus or could print something off the internet that would provide them with an idea of what menus are well for restaurants that are close by. Does that fit for your plan?
Okay.
Okay.
Okay. Okay, so let's talk about the process for scheduling the home visit observations. So I'm actually going to skip ahead a slide. So this is a form that Marty has created to help organize, schedule those home visits. This form has a process that goes along with it, and that's in your binder under tab 7. I really, that's sort of just one way that can happen. So I want to have a conversation about what would work best for you in terms of these scheduled. So some of the things that we have worked out with the other sites that are participating is, they definitely want to start talking to families as soon as possible to try to find people who would be interested. One tactic that I think people have would work well is approaching families who have sort of a more regular visit schedule, like they tend to have it on the same day, so that you would know what day and time they would be having it further in advance. Does that sound like that would work for you, or what are your thoughts on that?
Are they expected the same amount of time, or should I tell them a little bit longer because it's being reviewed, or it's still a expensive visit, or should it be like 45 to an hour?
They may want to take time for just a little extra, because what we will need to do, and so the observations will be done by the study staff here from MPHI, and we'll need to do is just have the client sign a consent form at the beginning to the consent to participate in the study and to have us there and to have their visit recorded. It shouldn't take more than 5 or 10 minutes, but it'd be good to include a little bit of extra time for that.
And you do it in their home, or do you want them in the office?
No, do it in their home. I mean, that's where they have their visits, right? They don't normally come to the office. Yeah.
We're to the office, mostly at home.
I mean, wherever they normally have their visit, that's where we would want to do it. We definitely, want to try to sort of pretend that we're not there and capture a normal visit as much as possible. So.
Any particular, like you said, use your regulars and have any age group you want. You want like the tiniest of newborns, or you want the older ones, middle-aged ones? We get them all. We get them newborns, the 1 day old to 18 months.
I think the only thing I would say about that is that it would probably be helpful if we went to a visit that wasn't one of the first couple, just because, because a measure looking at sort of the relationship between the home visitor and family, it would be good if we in visits where that was sort of already established.
Now, is there any particular ones you want, like drug exposed, or you want people with multiple?
No, I don't. Yeah, I don't think there's a particular type. It would be great if we could get, sort of a variety, but we don't need to limit it to particular groups. It's I think the most important thing is that we're able to get one family per visitor that consents. So I wouldn't want to put any other limitations on it. Just make sure that we can get the number we're looking for. Okay. So then into the process, I'll have Mark send this to you, and then so that you have it and you can start approaching families. And then as you identify families that would be interested, then we can our calendars to make sure that we have people available to go to those visits.
Okay.
Is this good?
Sounds good.
Okay, great.
And then two each, right? One?
Yep. For each staff member that does home visits, we only need one family.
Oh, I've been telling a lot of people.
No, it's just one family.
Okay.
That's it. Another thing that some of the other sites have asked us for is if they could have the consent forms to share with families when they're approaching them about it. So is that something that you think would be helpful for more information? Okay. So I'll post to you. I think the rule of our IRB are that we have to be the ones who are there when they sign it, but you can definitely share it with them because it gives a lot more information about what it means to participate. I'll send you that.
Oh.
Okay. So then last piece that I want to talk about is agenda. And we touched on this a little bit, and Cynthia showed you how in the guidance document there's some information about the agenda. There is a very basic site visit agenda under tab 8 in your binders. Basically lays out the sort of basic structure for the day. So there's time set aside at the beginning of the day to do introductions, and show the reviewers around, and then from 8:30 to 2:30, and the reviewers will be reviewing the documents you're providing on site. And on guidance document, just so you can get a sense of what they'll be looking at when, there are these, here's one. It says in here there's like a time period. See how it says like 2 to 2:30 right here? So to help keep the reviewers on track, but it also gives you an idea of when they're going to be looking at what. And this part is actually the tour. So you can see that the tour is supposed to happen between 2 and 2:30. And from 2 to 4 is when they'll be doing the interviews. From 4 until 4:30, there's time set aside for an exit interview, a closing meeting, whoever wants to attend that, and that's when the appointment will be set for time to go over the quality report for that phone conference. Questions about agenda?
No.
Okay. That is everything. That's all the information. Are there any questions that you have of it?
No.
I have all of your email addresses and everything at the end, okay?
Yep. There's contact information behind that last tab, tab 9, that has, so and I are on there. Your reviewers are on there. Your reviewers are Suzette and Dawn. And then Sam Jones, she's the one that's helping with materials, and Marty, she's the one helping with scheduling. And then Julia is on there as well. She was able to be here today. But if you need to contact her, her contact information is there as well.
Okay. So this is just if they ask me about, they're going to be recorded, right? Are this going to be used for other sites, or is it going to be internet, or just for?
No. So it's strictly confidential, just for the purposes of the study. So we won't use the recordings for any other purpose other than this specific study. We're only keeping them for 3 years, and then we're destroying them.
Okay.
That's in the consent form. Then that information is in there too. They have it, and we have them sign the consent form just like they'll have their own copy.
Okay. So now, in the 6 months, at the end, we share with them the report, or is just for you guys only?
The quality report?
Yes.
Yep. I mean, that's up to you. You can share it with anyone that you want.
Okay.
Right?
To my knowledge, absolutely.
Confidential.
Yeah.
Okay. Wonderful.
All right. Well, thank you again so much. We're so excited to have you participate in the study. And one other thing I forgot to mention is that another part of the study, which you may have noticed in your consent forms, is that one of us will also be there during the site visit, just kind of observe and see how things are going. And that's going to be Julia. So you get to meet her. She'll be there on November 17th for your site visit. Yeah, she'll just be sitting to the side and observing what's going on and taking notes. So.
Will you Jen?
Am I? Sorry, I'm not available. I would love to meet you all. I would. Maybe there'll be another opportunity for us to meet in person.
You have to put a face with a voice.
Right. Maybe we could add our pictures to the next presentation too, Jen. I know everybody should send in their picture so we have all pictures on the PowerPoint presentation.
That's a good idea.
So you know who you're talking to.
Yeah,
that's a great idea. I'm going to do that, Cynthia.
You suspect that as you start to prepare for this and as you start to dig into it a little bit, I just have a hunch that you may have questions that develop. And so just know that any of us are available to answer questions, and that is your primary contact for most of that. But any of us are available to support you in this process.
Okay. Thank you. Good. No, thank you. It was short and sweet. I was thinking we was going to be here until 5 o'clock.
We're giving you a free hour.
Hour. Wonderful.
Merry Christmas.
Yeah.
Exactly.
Well, good rest of the afternoon.
Okay.
Yeah. All right. Thank you so much.
Thanks a lot, everybody.